Counselling for Hypertension Lifestyle Modification. Good morning, Mrs. Latha. I can see that you came to today's health camp for a routine health checkup, and your blood pressure has been recorded as 158/96 millimeters of mercury. Although you feel completely well and have no symptoms, this reading is higher than normal. One blood pressure reading alone does not confirm hypertension, so your blood pressure should be measured again using the correct technique and reviewed on a follow-up visit. However, this is an excellent opportunity to begin healthy lifestyle changes that can help control blood pressure and reduce your future risk of heart disease and stroke. High blood pressure is often called a silent disease because many people have no warning signs, while it gradually damages the heart, brain, kidneys, and blood vessels. The good news is that healthy lifestyle habits can make a significant difference, especially when started early and continued consistently. Let us discuss a few simple changes that you can begin today. First, focus on eating a healthy, balanced diet using the DASH approach, which stands for Dietary Approaches to Stop Hypertension. Try to fill half of your plate with vegetables and salads, 1/4 with whole grains such as whole wheat chapati, millets or brown rice, and the remaining quarter with healthy protein sources like dal, beans, fish or skinless chicken. Include fresh fruits every day and choose low-fat milk or curd whenever possible. Reduce the intake of fried foods, sweets, bakery products, processed foods, and sugary drinks. One of the most important steps in controlling blood pressure is reducing your salt intake. Aim to consume less than 5 grams of salt per day, which is approximately 1 level teaspoon from all sources combined. Remember that salt is not only the salt added while cooking, but also the hidden salt present in packaged and processed foods. Since you mentioned that you enjoy adding extra salt and pickle to your meals, try gradually reducing this habit. Limit pickles, papad, chips, namkeen, instant noodles, packaged soups, sauces, and processed foods, because they contain large amounts of sodium. Instead of adding more salt, enhance the flavor of your food with lemon juice, garlic, ginger, pepper, cumin, coriander, and fresh herbs. Whenever you purchase packaged foods, take a few moments to read the nutrition label and choose products with lower sodium content. Freshly prepared home-cooked meals are usually a healthier choice than processed or ready-to-eat foods. Your current body mass index is 27.4 kilograms per square meter, which indicates that gradual weight reduction would also help lower your blood pressure. There is no need for strict dieting or skipping meals. Even a modest reduction in body weight can improve blood pressure control. Eat regular meals, reduce portion sizes, increase vegetables and fruits, avoid sugary drinks, and choose healthy snacks instead of processed foods. Physical activity is another important part of treatment. Since you mentioned that your daily physical activity is minimal, start slowly and gradually build your routine. Aim for at least 150 minutes of moderate-intensity physical activity every week, such as brisk walking for 30 minutes on at least 5 days a week. If 30 minutes feels difficult initially, begin with 10 to 15 minutes and increase the duration gradually. You may also include simple muscle-strengthening exercises twice a week after discussing them with your healthcare provider. Staying physically active not only lowers blood pressure, but also helps maintain a healthy weight, improves heart health, and reduces stress. If you consume alcohol, reduce it as much as possible or avoid it completely because alcohol can increase blood pressure. If you do not drink alcohol, there is no health benefit in starting. Also, continue to avoid smoking and exposure to tobacco smoke, as these significantly increase the risk of heart disease and stroke. Managing stress is equally important. Spend time relaxing with your family. Practice deep breathing, meditation, or yoga. Maintain regular sleep and engage in activities that you enjoy. Lifestyle changes are easier to maintain when the entire family supports healthy eating and regular physical activity. Before you leave today, let us make a simple plan together. From this week onward, you will avoid adding extra salt to your meals, reduce your intake of pickles and salty snacks, include more fruits and vegetables every day, start brisk walking for at least 15 to 30 minutes daily, monitor your weight regularly, and return for a repeat blood pressure measurement as advised. Remember, lifestyle modification is an essential part of blood pressure management, but if your healthcare provider prescribes medication, it should be taken regularly along with these healthy habits. By taking small but consistent steps every